Hello everyone, it's Nurse Katrina, and today I want to discuss left-sided heart failure. Okay, so congestive heart failure. Today we will discuss left-sided heart failure because you know there's left-sided heart failure and there's right-sided heart failure. So let's focus on left-sided heart failure. Remember, to understand the entire concept of CHF, you have to know the medication, the diagnostic procedures, and the nursing skills. Okay, so what causes left-sided heart failure? Left-sided heart ventricular failure. If someone has hypertension, chronic hypertension, coronary artery diseases, and valvular diseases. Just think about it. When I think about left-sided heart ventricular failure, hypertension, someone having high blood pressure year after year after year, coronary artery disease, when the vessels, the arteries are clogged. Maybe this patient has hypertension, high cholesterol, poor eating habits, and valvular diseases can cause left-sided heart failure as well. So what are the signs and symptoms of left-sided heart failure? Remember, left side, lung, left side, lung. So this patient is going to have dyspnea, shortness of breath while laying down in the supine position. So the patient may state, I feel like I'm drowning when I lay down. The patient may also have frothy, blood-tinged sputum, difficulty breathing. When I met a patient who had left-sided heart failure when I was in clinicals, I remember him because he was sitting on the edge of the bed, leaning over the bedside table just to get some relief, because if he laid flat, he couldn't breathe. So I always remember this gentleman was my first patient with left-sided heart failure when I did my clinical rotation. Labs, increased BNP. I never like to say, oh, this is the definitive lab, but if I had a patient who has left-sided heart failure, I'm going to look for the BNP. I need to see the lab values because it will increase if someone has left-sided heart failure. This is the lab that I'm watching throughout the entire shift. Left-sided heart failure complications, pulmonary edema, guys, cardiogenic shock, and pericardial tamponade. So these are some of the left-sided heart failure complications. I'm monitoring my patient's lung sounds. I'm listening to his heart sounds. So this is the reason why we learn to listen to the heart sounds. We're listening for that lub-dub because pericardial tamponade can appear. Cardiogenic shock, pulmonary edema. So every time I walk into the patient's room, I'm listening to the lungs and I am listening to the heart sounds with my stethoscope. Nursing interventions priority. What is my priority? So I kept it very simple. You're going to have to go and review your book, no doubt, but I don't want to overwhelm you. I want to give you some priority, some of the things that I saw that I want to share with you. Daily weights. If I have a patient who has left-sided heart failure, I'm weighing that patient. Input and output. I need to see your urinary output. I need to know how much you're taking in and how much you're taking out. Because if someone has left-sided heart failure, they may not be perfusing the way that I need them to perfuse. I need to know that this patient is putting out this amount every hour and he's taking in this amount every hour. So this patient may be on fluid restriction. Oxygen. I need to know his O2. And I'll put this patient in a high Fowler's to help him breathe. High Fowler's position expands the lungs. Medication. So we're going to talk about two major medications, digoxin and furosemide. Left-sided heart failure the patient is taking DIG, I have to monitor that patient for digoxin toxicity. If the patient is taking furosemide, I have to monitor the patient for hypokalemia, potassium, okay? A low potassium. Patient teachings. For DIG, if a patient is taking digoxin, teach the patient to take apical heart rate for 1 minute. Hold the medication if apical pulse is less than 60 beats per minute. And if someone is taking furosemide, tell them to increase potassium-rich foods, because furosemide, the patient is at risk for hypokalemia. So you have to monitor that. Some facilities, when you give a patient furosemide, the machine will automatically, the Pyxis or the charting will make you put in the potassium level. So you have to actually enter the potassium level before you can administer the furosemide. Medication administration, guys. Again, for digoxin, teach the patient to take the apical heart rate for 1 minute. Hold the medication if the apical pulse is less than 60. Now, if someone is taking furosemide, if their potassium is low, do not give that patient that furosemide. Now, these are the diagnostic procedures for left-sided heart failure. So hemodynamic monitoring, because they want to measure the central venous pressure. They want to measure the pulmonary wedge pressure, because they need to monitor the cardiac output. Echocardiogram measures the ejection fraction of the heart. And the T obtain a view of the cardiac structure. So this will actually give the physician a visualization of the heart. So nursing skills. What are the priority nursing skills? Tell the patient to remain on a low sodium diet. Remember, where there's sodium, there's water. Where there's sodium, there's water. So this patient may be on fluid restriction per MD order. Measures weight daily at the same time. So make sure you know this, guys. Notify the provider of a gain of more than 2 pounds in 1 day or 5 pounds in 1 week. All right. And report swelling or of the feet or the ankles, or any shortness of breath or angina. All right. So make sure that you know your skills is basically teaching, and your real psychomotor skill here is measure weights daily. Make sure you do it at the same time. Make sure the patient has, if the patient had on a gown on Tuesday, Wednesday, put the patient on a gown. All right, guys, that's it. So just sweet. These are just a little tips. All right. So like and subscribe. And my class begins October 20th. It's a 13-week course. Okay. So I'll start off with a NSCBN 2019 comprehensive exit. And then we'll work through every week dealing with the major content areas. And week 13, you'll take the exit B. So this will get you ready for the NCLEX. If you have already taken the NCLEX and you were not successful, this can help you also. All right. So I hope you enjoyed, and I hope this helps.